Esteemed Rotary colleagues, global leaders, changemakers, friends. My name is Dr. David Walton, and I am the U.S. Global Malaria Coordinator. In that capacity, I'm charged with oversight and coordination of all resources and international activities of the U.S. governments relating to efforts to combat malaria, including the U.S. President's Malaria Initiative. 2 months ago, I was visiting the Dewport Road Clinic, a high-volume urban health center in the heart of Liberia's capital city of Monrovia. I was there to see the clinic in action and also understand its role in malaria control efforts. While I was touring the clinic, I saw a prominent sign at the clinic entrance that read, "Rotary Clubs of Liberia, Zero Malaria Starts With Me." The sign is a reminder of Rotary's deep roots in so many of the communities PMI serves, and is a testament to the commitment to service above self that you bring to the communities you live and work in, and the power that we can bring collectively to the fight against malaria. Since 2006, PMI has been working where malaria hits hardest, across 24 countries in sub-Saharan Africa and 3 programs across the greater Mekong in Southeast Asia. PMI is the U.S. government's largest malaria program, delivering evidence-based life-saving interventions, and we've contributed to saving nearly 12 million lives. However, we didn't do it alone, and we can't finish the fight against malaria without partnerships like the one we have with Rotary. For example, in Zambia, Rotarians have trained over 4,000 community health workers. Rotary's partnership with the Bill and Melinda Gates Foundation and World Vision is an excellent example of the kinds of support Rotarians provide to help ensure that community health workers are equipped to address malaria in hard-to-reach communities. PMI has supported this investment by providing on-the-ground technical expertise to help ensure that malaria tests and medicines reach those health workers. In Uganda, a nonprofit called Pilgrim Africa conducted a study to better understand what combination of current tools were the most effective in reducing the community's burden of malaria quickly and at low cost. PMI helped design the study while Gates and Rotarians provided the funding. Rotarians were also key partners throughout the implementation of the study, liaising with community health members to iron out the challenges. These are just 2 instances among many, so I want to thank you all that Rotarians have done in the fight against malaria. You have been part of the tremendous progress against this preventable and treatable killer. Unfortunately, however, progress against malaria has stalled for several years. Around the world, a child still dies of malaria almost every minute. There are 3 major challenges that continue to threaten our progress. First, the effects of COVID-19 and other outbreaks like Ebola and cholera have contributed to significant disruptions to service delivery for malaria. COVID-19 is estimated to have contributed to disruptions that have led to an estimated 68% of the additional deaths from malaria in 2020. Second, climate change is bringing more extreme weather events and more unpredictability in weather patterns, making it much more difficult to control and prevent malaria. And third, some of our key tools against malaria are in jeopardy because mosquitoes are continuing to develop resistance to insecticides, and the malaria parasite is developing resistance to critical drugs used for treatment. Our old ways of working and our existing resources are no longer enough. To solve these complex and ever-evolving challenges, we need the help of organizations that are committed to ending this disease. We need people who are passionate and believe in action. We need Rotarians now more than ever. For decades, you have been a key champion of health through your investments in polio and water and sanitation, and now malaria. The work Rotarians have done has built the scaffolding for better health systems so that our tools, new and old, can be more effective. Going forward, Rotarian champions will play a critical role in expanding available resources and identifying new pathways for the progress in the fight against malaria. How can you help? We need your help mobilizing national and community leaders who have the power to affect change by ensuring malaria prevention and control has a prominent place on country's health agenda. We need your business savvy and creative ideas to expand the resources available to support the health of thriving communities. Malaria prevention and treatment is an extraordinarily cost-effective public health intervention. Every $1 invested in malaria control returns $19 in economic growth, contributing to countries' prosperity and prospects as trading partners. We need your knowledge and experiences from your polio eradication efforts as the first ever malaria vaccine ramps up to be distributed at scale in endemic countries. Distribution of this vaccine will leverage the strong foundation that you've helped establish with the polio vaccine. Community health workers are primed and ready to distribute this new life-saving tool because of your strategic investments in the trusted source of community-led health. If we're going to create a world in which no child dies from a mosquito bite, we need more voices and more resources. We need the help of Rotarians now more than ever. We need your partnership, your ingenuity, and most importantly, your leadership. Zero Malaria starts at Duport Road Clinic in Liberia. It starts with Rotarians. It starts with us. I wish you a successful Malaria Congress and International Convention.